How do biomarkers advance cystic fibrosis treatments? Biomarkers are essential in advancing treatments for cystic fibrosis. They provide measurable indicators of disease activity and treatment responses. This information helps doctors personalize therapies for each patient based on their unique genetic makeup. Cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane conductance regulator gene. These mutations lead to problems with the cystic fibrosis transmembrane conductance regulator protein, which affects the transport of chloride ions. This malfunction causes thick mucus to build up in organs, particularly the lungs. One key biomarker is sweat chloride levels. This test measures how well the cystic fibrosis transmembrane conductance regulator protein is functioning. It is the gold standard for diagnosing cystic fibrosis and assessing the effectiveness of cystic fibrosis modulator drugs. New wearable sweat sensors are being developed to measure these levels continuously and non-invasively. This innovation could greatly improve day-to-day clinical decisions and treatment adjustments outside of specialized labs. Biomarkers also help identify which patients will benefit from specific cystic fibrosis transmembrane conductance regulator modulator therapies. For instance, biomarkers related to the cystic fibrosis transmembrane conductance regulator gene can guide the use of triple combination therapies. These therapies, which include elexacaftor, tezacaftor, and ivacaftor, are particularly effective for patients with the common F508del mutation. By screening various cystic fibrosis transmembrane conductance regulator gene variants and their responses to modulators in laboratory settings, clinicians can predict which patients will see clinical benefits. This personalized approach is vital, especially considering the high costs and lifelong commitment to these therapies. Monitoring biomarkers during the initial treatment phases is crucial. It helps confirm whether a patient is responding to the treatment, which is important for managing their care effectively. Beyond cystic fibrosis transmembrane conductance regulator function, researchers are exploring emerging biomarkers that track inflammation, changes in the microbiome, and the multi-organ effects of cystic fibrosis. These insights could refine personalized care and long-term management strategies. In conclusion, biomarkers are transforming cystic fibrosis treatments. They enable precise diagnosis, guide personalized therapy selection, and monitor treatment responses. This biomarker-driven approach is shifting cystic fibrosis care from a one-size-fits-all model to a more tailored strategy. This change aims to improve the quality of life and health outcomes for those living with cystic fibrosis. Always consult healthcare professionals for personalized medical advice and treatment options.